Instructional factors impact a student's access to and progress in the general education curriculum and environments and should be addressed further in the IEP. Research has confirmed that students with disabilities can have positive outcomes when their needs are appropriately addressed through services or accommodations. Any of the special instructional factors identified as an area of need should be addressed further in the IEP. The IDA lists factors that must be addressed in every IEP. These include behavior, limited English proficiency, visual impairment, communication, and assistive technology. In Alabama, the need for adaptive PE, instruction using alternative standards, and transition are also considered special instructional factors. Does the student have behavior that impedes his or her learning or the learning of others? If so, positive behavioral interventions and supports and other strategies to address that behavior should be developed and implemented. These include a measurable annual behavioral goal, supplementary aids and services, or specially designed instruction. Does the student have a behavior intervention plan? If yes, that plan should be included in the IEP, whether created by the district or other service provider, or by using the optional forms provided by the State Department of Education. Does the student have limited English proficiency? If yes, the IEP team must consider the language needs of the child related to the IEP. There should be documentation on the first page of the comprehensive student profile that an EL plan has been developed for the student. Students may receive both special education and English language services concurrently if the IEP determines both are appropriate. Does the student need instruction in Braille or the use of Braille? If yes, for a child who is blind or visually impaired, they should be provided instruction in Braille and the use of Braille unless the IEP team determines, after evaluating the child's reading and writing skills, needs, and appropriate reading and writing material, that the instruction in Braille or the use of Braille is not appropriate for that child. Services in response to this question can also include evaluating the child's future needs for instruction in Braille or the use of Braille. Does the student have communication needs? If the answer is yes, in the case of a child who is deaf or hard of hearing, the child's language and communication needs, opportunities for direct communication with peers and professional personnel in their language and communication mode, their academic level, and the full range of needs must be considered and addressed. This includes opportunity for direct instruction in the child's language and communication mode. Services that may also be included are those provided by a speech-language pathologist to address language disorders, articulation, stuttering, voice, and augmentative communication. Does the student need assistive technology devices or services? This factor must be addressed in the IEP when the student needs an assistive technology device or service for academic or functional needs to include an evaluation of the child's potential assistive technology needs and training in its use for the student and related personnel. Assistive technology provisions should be detailed on the services page of the IEP. All physical education instructors who hold Alabama grades P through 12 PE certification are required by law to provide instruction to all students, including students with disabilities. IE teams must answer the question, does the student require specially designed PE? If the answer is yes, the PE teacher should provide input to the IEP team for consideration and work collaboratively with the case manager to determine the present levels and develop goals and benchmarks. When teaching the state PE standards, make accommodations or modifications based on the individual student's needs. Supports from an adaptive PE teacher or paraprofessional may also be necessary. As a reminder, adaptive physical education is a direct service and not a related service. Has the IEP determined that the student meets participation for criteria for the Alabama alternate assessment and will be taught using the alternate achievement standards? IE teams must utilize and attach the ACAP alternate participation decision-making tool form to make this determination annually. If students meet the participation criteria, the IEP team should develop annual goals and benchmarks for reading, math, functional skills, and any other areas determined necessary by the team. Provide instruction using alternate achievement standards and ensure the student is afforded appropriate accommodations when participating in instruction and assessment of these alternate standards. Are transition services addressed in this IEP? Transition services must be addressed for middle school students who will be turning 16 or older during the implementation of the IEP, or for all high school students beginning in the 9th grade and beyond. When transition is to be addressed, students must be invited to participate in the development of the IEP, including the IEP team meeting. The transition pages of the IEP must be completed, taking into consideration the student's preferences and interests and the results of recent transition assessments. Remember, any special instructional factor identified as an area of need should be addressed further in the IEP.